Hey 1PM, you're listening to the 5-minute summary of this episode. If you're at the right place, enjoy.
Wait, there's more. Just to quickly round it out, because we are in our years of OSCEs, I have a quick OSCE station. You guys can take this on as a team, and I'll be your assessor. Okay, so I'll read the trigger. Mrs. Howell is a 78-year-old lady from home alone who has been brought in by her daughter, who tells you that Mrs. Howell has been generally unwell and feverish for the past 7 days. This is on a background of rheumatoid arthritis for which she's on methotrexate. She has no known allergies. Currently, Mrs. Howell is drowsy and unable to answer any of your questions. You have a look at her OBS chart, and they are as follows. Her respiratory rate is 26. Her O2 saturations are 88% on 2 litres through nasal prongs. Her heart rate is 105, blood pressure 85 on 50, and she's febrile with a temperature of 38.2. You perform a top-to-toe examination. Her skin is warm and mottled. Her pulse is bounding. Her examination is otherwise unremarkable. So there's no rash, no bleeding from anywhere. Your tasks, if you choose to accept them, are to outline your immediate management and answer some examiner questions. Okay, so how are you going to approach this station, guys? Does anyone want to take the lead? Boom. Yes, I love it. Going to start with an A through E assessment. Go through A, all clear, all normal. Go through B, but her oxygen sats, they're low, so what are you going to do?
But she's already on nasal prongs.
Yep.
2 litres, probably
2
more.
litres. So you could either increase how much she's getting through her nasal prongs, or you could consider something else.
CPAP?
Exactly. Perfect. Great. So you move on to C. The blood pressure is 85 on 50. What are you going to do?
Or cannulate bilaterally in both the cubital fosses. Bolus 30 mils per kilogram of fluid.
Amazing. Great. She's improving. You're saving lives right as we speak.
This is very detailed.
Before you put the boluses in, what kind of blood tests do you want to send off, like right away?
So VBG,
Yep. Boom.
blood cultures, pass it on to Neen.
Sugar level,
Yep. And then
like CRP, FBC, UEC,
and
then coax and Grippenhall.
boom. Love it. You've got these boluses going. Blood pressure's improving, but she seems kind of dry. Giving her all these fluids. You're going to start a fluid balance chart. Plus or minus insert an IDC. I want to keep tabs on this lady's urine output.
I want to measure.
I want to measure that
what it
urine.
is, in and out.
Yep.
What if she gets a UTI from the catheter?
That would suck, but that's for another problem. We're going to be filling her up with antibiotics in any case, which brings us to the antimicrobials.
Yep. So I would start empirical antibiotics for a community-acquired sepsis. So that would consist of gentamicin, cloxacillin, and vancomycin.
Yep, because she's in septic shock. But would you give Kef?
Depends if I think the cause
She's
is...
got no rash.
Yeah, probably not then.
Sure.
But
I would agree. Jason. Well done.
make my doubtless.
We've taken our blood cultures. We're monitoring her urine output. We've started antimicrobials. We've increased her O2 therapy. We're giving her fluids. We've measured her lactate. I think that's the 6.
Do you know what? I think we failed. Do you know why?
Why?
You didn't call for help and call medical.
All right, well, that's a good point. So because this is an OSCE station, there's a bunch of other fluffy stuff that we should add into it. So you've done your A to E. What can you do? As soon as you look at her OBS, what are you going to do?
Recognize the patient is in shock and call for help with Metcall.
Boom, I
Call
love
the
it.
code blue.
Code blue, SOS, help me. Okay, so now you've kind of stabilized her. Hemodynamically stable, but not out the woods yet. What else can you do? Like, she's in ED, from a logistical point of view.
Transfer her when she's stable to ICU.
Boom. Who else?
RFDS if they're tertiary or if they're rural.
His rural GP's on his
Fucking
head today.
Hey man, I'm telling you now, they will chuck in rural wherever they can in these OSCEs.
It's true.
When you see rural on an OSCE, just RFDS, like...
Okay.
That's
or
all you
even
write
say
in
hi
your,
to them. Like before the A to E, just start calling the plane.
Or call a plane for my
'Cause I guarantee you
management.
forget it, and then they'll be like, "What do you?" Anyway,
Cool. So we've got an ICU review. If this person's got an infection, who else might you call?
infectious disease.
God, yes, infectious diseases. Cool. A lot of these hospitals will have a sepsis pathway, so you might activate that. So you've stabilised her, you're like, all right, ICU's on the way, ID's on the way, sepsis activated, your senior's like, all right, cool, man. You take it,
Avengers Assemble.
you take it from here, and then you're like, all right, let's take a breath, let's revisit the history and examine it. Let's talk a bit more to the daughter and try and figure out what's been going on, right? What other investigations might you consider?
Portable chest X-ray.
Urinalysis, ECG.
So that's really good. Other things you might do, you might monitor their lactate levels just to see if, what you're doing is working. And then you might also monitor for complications because we don't want to dropping off a cliff. So you've answered the first part of the OSCE task. Well done. Second task, we've got some examiner questions. All right, examiner questions. What are 5 risk factors for developing sepsis?
Immunocompromised.
I love it. Good. Bang.
Breaks in the skin.
Good.
IV drug use.
Good. Yes.
Old age and young age.
Perfect. So you get that bimodal distribution, they say.
Long-term steroid use.
Good. You've got your 5, but can you keep it going?
Autoimmune conditions.
And other chronic illnesses. So amazing. What are 5 clinical features associated with sepsis?
Hypotension.
Tachypnea.
Tachycardia.
Fever.
Altered mental status.
Good. I don't think I can think of any others. Well done. And your final question, what are 3 complications of sepsis?
Death.
Yep.
Damn it.
Oh, and organ damage.
Yep. So any kind of failure, really. Or all of them could happen. You could have many organs fail, which is called
multi-organ failure. Death? I don't know.
Multi-organ dysfunction syndrome. So that wraps up sepsis, guys. You absolutely smashed that.
Did we really?
I think you did.
Thanks everyone for tuning in to our OSCE summary episode. Check out 1pm.wiki, and for all your first principles, keep it right here at 1pm.